Now, today we are focusing on infection, introduction of infection in our today's lecture. So we will ask ourselves what is infection, we see various definitions, infections, the various terminologies, the various partial infection in today's lecture. So what is infection? Infection is the invasion of our body tissue by any disease-causing microorganisms, that is the pathogens, which interferes with our normal physiology of our body. And these microorganisms either they produce toxins which interfere with our body functions. And these microorganisms can be either a virus, a proteus, or bacteria, or virulence, or even big microorganisms which are like parasite or fungi. So disease and infectious disease. So what is a disease? A disease is really the deviation from the normal well-being, from the unique physiological functioning of the body to the well-being. Whereas infectious disease is a disease condition that is caused by presence or use of infectious microorganisms or parasites in our body. Okay. Let us look at various definitions. Another one is like pathogenicity and virulence. So what is pathogenicity? Pathogenicity is the ability of the microbe to cause a disease. Is it to cause a disease? There may be a microorganism in but is it able to cause a disease? So this is often described as killing species. Another terminology is the degree of pathogenicity, which is virulence. At what level does it cause microorganisms? So at this point, you should be able to ask yourself a very simple question. If you isolate one microorganism of Salmonella typhoid and put it in water, is it enough to cause a disease? If people take that water. So we have acute infection versus chronic infection. So in acute infections, it is characterized by sudden onset and rapid progress and often severe symptoms. Whereas chronic infection, it is gradual onset and slow progression. An example of acute infection is pneumonia, and an example of chronic infection is AIDS. And various microorganisms causes various effect on our body, like bacteria, virus, fungi, protozoa, elements, and prions. So there are various things. There are various types of infection. There is a infection which is primary, and there is secondary infection. In a primary infection is an infection that develops in a health-wise person. But in a secondary infection is an infection where somebody has an infection and then there is another infection which on top of that. For example, somebody who is HIV positive can get TB infection. So a TB infection in this case is a secondary infection. So we have other like localized infection and systemic infection. In a localized infection, that is where the infection is restricted to a specific organ or to a specific part of the body. For example, an infection can be localized in the liver, an infection can be localized in the brain, an infection can be localized in the eye. Whereas systemic infection is when the infection is systemic in the body, systemic in the body, the whole part of systems is affected. For example, an infection can affect the ovaries, the fallopian tubes, the uterus, the vagina. It is affecting the reproductive system. So that is a systemic infection. So there is clinical infections and subclinical infections. In a clinical infections, there is obvious an infection and obvious clinical symptoms. For example, some only pneumonia and then you manifest with cough. That means it's clinical. Whereas there is some clinical conditions where somebody has an infection, where there is no obvious symptoms. So there is something called opportunistic infection. In an opportunistic infection, they are found normal flora, normal microorganisms which are eaten by going into our body. They were there to assist us. But when the environment changes, they can also become an enemy to us. A good example is the candida which was created by going to the vagina of women. yet to have a specific function or a defense mechanism. But when the environment changes, they become pathogenic. For example, the environment can change because of sugars in the body of growing unit. The other one is epidemiology. So what is the epidemiology? Epidemiology is the study of the disease, transmission of disease. So it is per se the relationship between the disease and the environment and the jungle. How the disease is related to the population, the environment, what is called epidemiology. Then we have communicable diseases. These are diseases which can be transmitted from point A to point B, from one person to the other. You can transmit TB from point A to point B. You can transmit TB from Kamau to James. Then we have contagious disease. These are communicable diseases that is easily spread from one individual to the other. Then you have non-communicable diseases. These are diseases which cannot be transmitted from one person to the other. An example is diabetes. The example is hypertension. Those are non-communicable diseases. So we have endemic disease. Endemic disease is that is normal, is a disease which is normally found in a certain percentage of our population, a certain percentage of our population. Then epidemic disease is a disease which is present at a greater than usual percentage. This is also the same one we call outbreak. It's also the other one we call outbreak. Then pandemic diseases are diseases associated with larger areas geographically, like it can be a disease in the continent, can be a disease in a region, and disease in the mountain, in the rural, in grassland, and disease in a town, in urban centers, in rural areas, in slum areas. So that is what we call pandemic diseases. Diseases associated with the geography. So we have another one which is called the residual of infection. The residual of infection is the source of agent of infection, the source where that the infection comes from. And then we have the carriers. The carriers are individual who carries an infectious agent without manifesting symptoms, yet who can transmit the agent from point A to point B. Then we have fomites. Fomites are inanimate agents capable of being in the intermediate in the direct transmission of infectious agent. Then we have animal vectors. There is animal vectors where the vector can be either biological vector or mechanical vector. In a biological vector, this is an example is a mosquito, means that there is a biological process which takes place. For example, in malaria and the plasmodium life cycle in malaria is sexual. There is sexual, whereas the sexual takes place in human being and the sexual takes place in the mosquito. That means the mosquito in this case is a biological vector. Whereas the mechanical vector is where there is no biological changes which takes in the microorganism which is carrying that vector. For example, of very common mechanical vector in the setup is the house fly. So we have the savior of infections, like can be either places in which infectious agents survive but may not multiply. For example, human being, animals, equipment, medications, intravenous food are most common the savior of infection. So human savior is we have various types of human savior, like persons with acute virulences. We have carriers, and the carriers can be either during incubation, convalescence carriers, or chronic carriers, or intermittent carriers. Then we have the nature of microorganisms. The nature of microorganisms is that microbes are very small living organisms which are not visible with our own naked eyes. You have to use a magnifier like a microscope, and the pathogens are the ones which causes disease. And there is non-pathogenic microorganisms which does not cause disease, and they are beneficial in our body. But sometimes they can become pathogenic if the environment changes. So we have at times a microorganism that is beneficial in one body, in bodies, and then becomes pathogenic later on. For example, in the change of systems. An example is Escherichia coli is a normal flora of the large intestine, where it starts to make a vitamin K, vitamin B12, but in the urinary system, if it can escape into the urinary system, then it becomes pathogenic, and it is one of the most common known to cause urinary tract infection, since the exit of gastrointestinal system is very close to the exit of the urinary system, more common in women. So at this case, it can escape and cause an infection. So non-pathogenic microorganisms can be beneficial by, for example, we use them in our daily life, for example, in fumigation because they are important lactic acid producing bacteria like probiotics which you use in yogurt making like Lactobacillus rhamnosus, like the Bacillus coolesi, like the Bacillus hence all of them they are types of they are types of microorganisms which are benefits in our setup. So there are various types of microorganisms. There are various types of microorganisms. For example, we have bacteria and we have various types of bacteria. We have simple bacteria. We have there are one-celled microorganisms and they are classified according to their shape and arrangement. And the various causes various diseases like the streptococcal causes throat infection, pneumonia can cause pneumonitis, and also TB can cause tuberculosis. So bacteria are also are treated using antibiotics, but because of our irrational use of antibiotics, it has exhausted the various strains of bacteria. And this one now invites another discussion, which is called about antimicrobial stewardship, where the antibiotics are not properly prescribed. They are prescribed not in the correct dose. They are prescribed unnecessarily, and this one results to microbial resistance, which is a big problem in this world. So less than 1% of bacteria are harmful, and they are more bacteria in amount than human living on the planet. Okay. So there is a lot of bacteria in our body. So we have various types of bacteria. We have bacteria which have chains, we call them streptococci, and we have clusters like staphylococci, and then you have diprococci, pairs, micrococci, tiny, and then flagellated forms like teals. We have bacillus, sweet and vibro. We have spirulum, spiral, and spirochetes like are common. Those are various shapes of bacteria, since the shape of bacteria are classified depending on their shape. So we have the fungi, which is a fungi is classified as a plant because it has some branches called hyphae, and the other front-like organism that lives in dead matters, and the easternmost can be pathogenic depending on where they are. They can cause various types of conditions like ringworm and the typhoid, yeast infection, and the grass. And the antibiotics does not use to treat fungal infection, and the treatment of fungal infection it is specifically antifungal. With fungal are harmful sometimes to our liver, and fungal can cause hepatitis, and fungal are very expensive and they are not many. They are not many, so you have to be very careful. You have to approach the fungal infection in a preventive perspective. So we have another type of microorganism which is called protozoa. Protozoa is one-cell animal which is found in key materials and contaminated water. Protozoa reproduce by binary by cell division. So many contains flagella which allow them to move freely around it and causes diseases such as malaria, trichomoniasis, amoeba, and dysentery, and infection. So we have rickettsia. Rickettsia is another type of microorganisms. The rickettsia are a parasite that live inside the cell of other living microorganisms, and they are commonly found in fleas, lice, ticks, and mites, and are transmitted human by bite of these insects. So they cause diseases such as Rocky Mountain, spotted fever, and typhus fever. So they are very effective treated by use of antibiotics. So we have also another types of microorganisms, we call them viruses, and they are the smallest of all microorganisms visible by, and they are only visible by use of electronic microscope. So cannot reproduce unless they are inside the living cell. And this is the reason why you have a big problem in treating viral infection, because HIV is because they live inside our cells, so you have to kill the cells so that you can kill HIV. And when you kill the cell, the amino cells, so you have to kill all the cells, which is not possible. So the viruses spread by various contact like blood and other fluids, and they are associated with diseases like common cold, chicken pox, herpes, hepatitis B, measles, influenza, and HIV/AIDS. So we have various types of viruses of concern, like hepatitis B, which affects the liver, hepatitis C affects the liver, and also HIV, which is a immune suppressor. And of late, there was a big discussion, there was a big problem the recent year about COVID-19, which will cause a lot of death. Then, what factors which influence microbial growth? Microbial growth can be influenced by the temperature. The microbes requires ambient temperature for them to manufacture, to multiply. It requires pH, it requires darkness, light, fluid, moisture, and the oxygen. Then we have other things like we have various types of bacteria. There are phagocytic bacteria which can survive where there is oxygen or no oxygen. We have aerobic bacteria or microorganisms which survive where there is oxygen needed, and we have anaerobic bacteria or microorganisms that survive where there is oxygen. So pathogenic microorganisms causes infections and diseases in a different way. So for example, they can produce toxins, which can be either endotoxins or exotoxins, which is either endotoxins or exotoxins, and this can cause a big problem. These ones now causes an effect on our body because they are very toxic. They destroy our cells, they destroy our systems, and an example is tetanus. Now, allergic reactions in the body can also be caused by these ones, because they can cause running nose, watery eyes, and sneezing. And also, these microorganisms can cause destruction of the living cells, and which can be an example is malaria, which destroys red blood cells. So we have endogenous, exogenous, and nosocomial and opportunistic infections. So what is endogenous? Endogenous means originates within inside the body. This one, the microorganisms causes metabolic disorders. They can cause congenital abnormalities, and also they can cause cancer. So we have exogenous types of microorganisms which originate from the outside the body, which can cause chemical agents and electrical shock and the trauma. Those ones can cause various types of what microorganisms which originate from outside the body. Then we have nosocomial infections. Nosocomial infections are microorganisms which are found in arid setups, and they can cause disease. Then we have opportunistic infections. Opportunistic is an infection which occurs on another infection. For example, pneumonia can occur in HIV AIDS. So let us look on how these microorganisms or our diseases spread. So the diseases spread various ways. For example, due to respiratory droplet, they can be because of horrible. That one there's some concentration because of direct contact and like shaking hands. And also spread through the urine, the blood also in the saliva, and sometimes even insect bite, for example, malaria. So some transmission are main five routes. For example, it has to have a conveyor, a vehicle, which can be either food or blood, which can be a cause of transmission of the disease. It can either be a vector bone, can be either a droplet, can be either a ion bone, can be either a contact, either direct contact or indirect contact. So in order for disease to occur and spread from point A to point B, certain conditions must be met. In one condition, it is not met, the transmission of the disease will never happen. And pathogens are everywhere, and preventing their transmission is a continuous process every day without any stop. So there is something called chain of infection. A chain of infection, what happens? So it is very propagated, one thing leads to the other. For example, there is an infectious agents. It is in a severe infection, and then this agent from a severe infection, either the cell or your vomit or desk, then it can go to a sustainable post, which can be either a human being, then it can go a port of entry, then it can go to a port of entry, and either it is the skin, either the root or the mucous membrane, and then this one is transmitted, and then it moves out of the body. So, infectious agents, pathogenesis as bacteria or viruses, Listeria, Apresia, pathogenic example is human body, environment, from it, all of these ones, like indoor, north, bed banks, even instrument are all the places where you can go to these of infections. So part of the exit of various infections in the body can be either through the urine, through the fecal, through the saliva, through the respiratory tracts, browning gastrointestinal tract, mucus, discharge, and also the tears. Also the tears. So chain of infection continuation is the mode of transmission can be either to one from either from the recipient or host or where it lives. So can be through direct contact or bone or droplet, and contaminated hands are one of the most common source of direct transmission. And in this case, hand washing is mandatory, so continuous as a major way of preventing infection. So it should be continuous out. So photo of entry can be either respiratory tract system, mucus, membranes, and gastrointestinal tract, and sometimes even undamaged skin. So in a susceptible host, for example, which is human being, one that is capable of being infected, and the microorganism must be present in danger enough space for there to be virulent. There's to be virulent. So the host must be susceptible, and the individuals with an immunity to certain pathogen can be susceptible. So if the immunity is low, if the host immunity is challenged, then the usually can expose to infection. So if defense mechanisms are intact and the immune system is functioning well, then the body can be able to fight infections on its own and control the diseases. So these body defense mechanisms are mucous membrane, cilia, cough and sneezing, and hydrochloric acid, tears in the eyes, fever, inflammations, white blood cells, and immune response produced by the antibodies. So the signs and symptoms of infections is the cardinal, remember the cardinal symptoms of infections, of inflammation, which is redness, swelling, tenderness, warm, drainage, readiness, and also loss of functions and the affected organ or structure of the body. So virulence factor and toxins. This is capability of the microorganisms to cause disease, depending on how their virulence and toxins. For example, the various microorganisms will have various types of virulence factor, like they have a specific enzymes which assist them to penetrate the structure or the tissues of the host. For example, you can see that coagulase is produced by Streptococcus aureus, streptokinase is produced by Streptococcus pyogenes, allilodenase is produced by many of the microorganisms, and the collagenase produced by many pathogens, glucosidine produced by many, and emulsin produced by many microorganisms. So another one is the liaison factors that we can be able to appear or patch or hold themselves in the so that we can actually what we can actually arrange. So we have also the produce exotoxins. Exotoxins is a type of bacteria. Exotoxins are a type of bacteria toxins with the following properties. They may be produced by either gram-positive or gram-negative bacteria, excreted by the bacteria, and the action does not necessarily require the presence of the bacteria in that host. It can also be produced somewhere else, and then it can precipitate somewhere else. And this is what is called septicemia. So the action of the exotoxin does not necessarily require the presence of that bacteria in the host. Most exotoxins are peptides and the proteins, and most exotoxins are heat sensitive. That is the reason why eating is a way of what is a way of management and treating and prevention of infections like sterilization. The other one is what is the impact of infectious or infections in our setup? They can cause a loss of economy, loss of revenue in the family, loss of productivity for the employees. They also prevent pathogen. Other children, other members of the family, caregivers can be contagious and have the disease. It can disrupt the activities. It can also affect the health care system. Many offices get sick, not inappropriate use of antibiotics, and also unhealthy expenses for administering medication in children. That one is effect of what? Or effect of infections in our setup. So virulence factors also, which is also the continuation of the previous, is saying that they can cause various type of toxic, cytotoxic, and other toxins. These ones can really cause various distractions in our body. So every member of the community can get infected, can get affected by infectious disease, and it is our responsibility to ensure that we prevent these infectious by having regular vaccinations or advancing public awareness, all of those ones that our community can do in a better way. Everybody, like children, young children, because of the low immunity, can get the infections. Pregnant mothers also can be exposed to this type of what infections. Also, elderly workers who are in patient go out all the time, also they have chances of developing this type of can be at risk. So why are children more vulnerable to infections? Because the immunity is not well developed. And hand washing is the best way to prevent infection. So thank you very much for listening to this lecture. Thank you very much. And I think everybody is going to practice hand washing.